What if I told you that a spot the size of a pencil eraser could lead to the surgical loss of a limb? For seniors, this isn't a scare tactic, it is a reality. Welcome back to the SOS series. Today, we are talking about the skin SOS. The purpose of this video is to educate both seniors and caregivers that the skin is the body's largest organ and the body's first line of defense. A small overlooked skin change in a senior can cascade into a life-altering infection and a limb loss. However, this ought not to be so. When skin changes are identified and addressed immediately, the senior can save a limb. Let's get started. This is Elizabeth Soros with the Seniors Aging Well Circle. The first aspect we're going to address is the reason why senior skin is a crisis waiting to happen. The three triple threat of aging skin. The very first one is that aging skin is usually paper thin defense. The thinner the skin, you have the less collagen, the fragile blood vessels that easily bruises, and with every knock on the door, they tear easily as well. The second reason why the senior skin is a crisis is because of the reduced sensation in aging skin. You have reduced nerve endings, which with less pain feedback, they may not feel a blister or cut, especially even in diabetic. That's the reason why it's actually very crucial for diabetic patients to actually make sure they have daily regular skin inspection. The very third reason is actually because of a sluggish healing. There's poor circulation, especially in the legs, in the lower extremity, for majority of the seniors, which means tiny wounds actually cascade easily. They don't repair or heal easily, therefore causing into very, very huge situations and which are easily more affected. The National Pressure Injury Advisory Panel, referred as the NPIAP, has identified 5 stages of skin changes that we are going to discuss now. These are 5 different SOS skin signals for senior to pay attention to and to make sure adequate follow-up with the physician or the nurse line is initiated. The very first one is referred to as a non-blanching redness. This implies that when you press the red area, it stays red. It does not change. This is considered a stage 1 pressure injury. This is not a bruise. It is a dying tissue beneath the surface. The damage starts from the bone outward. The action is never massage it, pressure off immediately, and notify the nurse or the doctor. The second SOS skin change could be referred to as the blister or the bump. This is a stage 2 pressure injury or could be an infected hair follicle. The skin barrier is broken. Bacteria can now have a direct entry to the bloodstream. And so the action is to assess for infection. If there is a warmth around it, increased redness around it, or there is any form of drainage, we are also supposed to seek medical advice before you start cleaning it with any specific solution that might not be advisable. Please seek to call your nurse's line or the doctor's office. The third skin changes in seniors I will refer to as the open sore, which could be a stage 3, an emerging stage 3 ulcer. It might be a small opening, but with some drainage, especially when the color of the drainage, when it changes. Often there is an underneath deeper wound The danger with this now wide open sore is the fact that it could be a wide open door for infection. So we need to make sure that we seek professional wound care immediately. The swollen, shiny, hot limb, which is often referred to as cellulitis, is the fourth SOS skin change, and it is a spreading bacterial skin infection. In cellulitis, infection, if not treated immediately, is moving fast and can lead to necrosis, which is dead tissue. The action is actually to seek medical advice immediately, because many times it's often require IV antibiotics, or such a much direct form of treatment. The fifth skin change, which is the last one, is the black or purple patch. When you have significant skin change and it is already black or it's purple, then it is often a tissue death due to lack of blood flow. This is often a very serious one, because now you might have dead tissue that cannot be saved anymore, and in order to prevent poisons to the bloodstream, that is when you have the surgical emergency, when this could lead to amputation, and many times this could be the only life-saving option. Now, let's look at how different situation connect the dots, because this progression could be shockingly fast. Seniors with immobility, especially those that are confined to bed and the wheelchair, require much more observation, because with a combination of immobility and thin skin that is common with seniors with aging skin, pressure sores on heels and sacrum are often common. Another connection is unnoticed, untreated sore deepens to the bone, which will become bone infection or osteomyelitis. And with bone infection and the poor blood flow, you have tissue dies, which is the gangrene. And when there is gangrene, the death of tissue, and sepsis risk, which is the higher level of infection, then there could be a life-saving form of surgical intervention, and that is when amputation happens. Now, this cascade can actually start in less than few weeks, especially for our bed-bound seniors. So it is important as caregivers to pay attention to what is going on with the skin changes in seniors. There are a few ways of prevention, and that is what we are basically going to address now: prevention and action to address these changes. One of the best times to check the skin is after bathing. The skin is clean, it is visible and easier to examine. So we want to make sure that we take a moment to look at the skin, to dry it gently, especially between the toes, and to inspect it. Note if you notice any redness or open areas, you want to report that immediately. You also want to compare one side of the body to the other to make sure that you're not missing anything. This routine actually takes only a few minutes, but it can prevent serious problems. It is important for seniors never to burst any blisters, so do not peel or any old scabs, because of the fact that you do not want an open sore that might take very long or might not heal or could be infected. So no peeling of scabs over skin and no busting of blisters. Also, we want to make sure that we are not walking barefooted, especially for diabetics, because of the loss of sensation. You want to avoid the possibility of getting items into your foot or having a cut and not being able to feel it and not being able to inspect the soles of the heels. And that is basically how sometimes with diabetics especially, how open sores actually start. We also want to make sure that we are not using any that we are not using any harsh antiseptics on open wounds. You want to keep strictly to the recommended, most of the time, recommended solution used for wound care. And many times the physician usually use normal saline. Another important prevention is to make sure that the skin is adequately lotioned in order to prevent dry skin, because with dry skin, sometimes you could actually start having cracked heels or open skin. For patients with blood thinners and very, very extremely thin skin, it is important to note to be more careful with navigating doorways, especially if they are in wheelchairs, or to make sure that we are not, I know it's not intentional, but navigating wheelchairs sometimes and knocking the arm or the foot. And that usually starts with the extra bruises that will also have open skin. And many times it actually takes very, very long time to heal in those category of patients as well. Never leave someone in a wet brief. This honestly is very, very important, that we need to change briefs often to not be able to start the beginning of redness. The skin is the canary in the coal mine. The mental fog SOS from our last video could be sepsis from an untreated wound. They are all connected. Early care can prevent infection, hospitalization, and loss of mobility. Skin checks are a powerful form of prevention, so it is highly recommended that seniors without a skin check protocol should start one immediately, because they will help seniors to stay safe, comfortable, and continue to be independent. And they will help caregivers to catch problems early when they are easier to manage. Download the free Skin SOS checklist in the description. And if you have found this video helpful, please comment, share, and subscribe for our next SOS series, where we tackle the pain SOS, how unaddressed pain can cascade into a bigger issue. Thank you so much.